What's up, friends? It's Haley Hines, aka Bird, and you are tuning in to the Give 'em the Bird podcast. This podcast is all about challenging what it means to be healthy and fit. It's about celebrating sustainable behavior change and non-scale victories. And most importantly, it's about giving the bird to the diet industry and societal expectations of body size. Why? Well, because at the end of the day, you have an entire life to live that does not require your body look a certain way. Thanks for tuning in. Now let's give 'em the bird. What's up, everybody? Welcome to Give 'em the Bird. My name is Haley, aka Bird, and I'm so excited to have you here. Recently, something that has been on my mind lately is hormone health. I feel like in the last year, this idea of hormone health has just blown up on my social media. And while I am a health and wellness and fitness professional, hormones are not within my area of expertise. Like, I have a very low level knowledge of the endocrine system. I know, the different mood boosting hormones, stress hormones, sex hormones, etc. But like how those hormones are specifically impacted is way over my head and not within my scope, outside of, what I work with people on. But recently I've been super intrigued by this idea of hormone health. And it's mostly because somebody I know has literally created an entire business based on helping women balance their hormones. And some of the recommendations that she gives out based on, comments and feedback that I see, it sounds like they really seem to benefit people. And, most of these recommendations are things like eat whole, unprocessed, organic food, or use quote unquote clean or cleaner products with less chemicals, take these natural supplements, like that sort of thing. And even as, an educated, qualified health professional, I'm still not totally sure if those measures and guidelines are actually necessary to balance our hormones. And to me, it kind of feels, those recommendations kind of feel like they toe the line with diet culture a little bit, right? Like cutting out processed foods, considering some foods good and bad, and all of those things. And at the same time, part of my brain is like, well, some of the symptoms that she's mentioning are symptoms that you identify with. And if you can just follow some of these recommendations and balance out your hormones and not have to deal with those symptoms, like maybe it's worth a try, right? And so I've literally been going back and forth for several months on whether or not I should jump on the whole hormone health balancing mumbo jumbo train. And, I recently ended up purchasing a program to help me do it. And while I was reading through it, I was like, oh shit, this is really diet culture-y. This does not seem like it's completely necessary. It seems a little bit out there. But just going back and forth for several months and not really knowing, what is diet culture from this, or what are some things that I should be doing to balance out my hormones? Like, do I actually need to balance out my hormones? All of this stuff. So when I found Dr. Gregory Dodell on Instagram, who on Instagram is everything_endocrine, he's an endocrinologist, and his whole thing is saying weight loss and restrictive diets, they're not the answer to hormone health. And when I saw this, I was like, okay, I definitely need to talk to this guy. So I reached out to him. He was up for chatting. And I swear to God, I had so many freaking questions, so many things that I wanted to ask him. And then we started chatting, and I realized that, most things in my life, I was making this idea of hormone health way more complicated than it really needs to be. And I think that you will understand what I mean by that once you get into the episode. So a little bit more about Dr. Dodell. He is a board-certified endocrinologist who received his medical degree from Albany Medical School and completed his internal medicine and endocrinology fellowship at St. Luke's Roosevelt Hospital Center, which is affiliated with Columbia University. He is currently an assistant clinical professor of medicine, endocrinology, diabetes, and bone disease at the Icahn School of Medicine at Mount Sinai, and he has his own private practice at Central Park Endocrinology PC. What I really appreciate most about Dr. Dodell's perspective is that he kept shit so simple for me. And it sounds like, if he kept it simple for me, I'm sure he keeps it simple for his own patients. And just talking with him, it's really clear to me that he truly believes in a patient-centered approach in medicine rather than the more common weight-centric approach that in my head has really plagued medicine. And so we spend a lot of time talking about weight bias, what it is, how it shows up, and how telling somebody to lose weight to manage their chronic conditions like diabetes just really isn't the answer. So instead, he offers up some really simple solutions to keeping our hormones healthy. And again, I think you'll be surprised at how simple and how, like, oh, duh, this stuff is. And I mean that in the best way possible. So it was super awesome to connect with Dr. Dodell, and I am really pumped to continue learning from him and to share this episode with you guys. But before we jump into the episode, I want to remind you to subscribe to the podcast wherever you are listening. And if you're tuning in from Apple Podcasts, please feel free to rate and review. Okay, now let's get to the good stuff. Enjoy, you guys. All right. Welcome, Dr. Gregory Dodell. How are you doing today?
Awesome. Good to be here with you.
Yeah, it's so awesome to have you on. So before we start talking about all things endocrine system, give me a quick rundown of who you are.
All right, cool. So I grew up in Los Angeles, came back east for school, and I want to be a doctor since I was, there's discrepancies. Some people say 8 years old, some people say 6 years old, under 10, definitely want to be a doctor. Always thought maybe pediatrician, and then I got to medical school and had a really enthusiastic endocrinology professor and was like, this sounds great, and I did it. And I'm married to a great woman, Alexis Coniston, who's in the field. At the Anti-Diet Plan is her handle, and she's got a book coming out, which is so exciting this summer, Diet Revolution. And we have 2 daughters, and we live in New York City, and that's it. That's the sum.
That's the sum. That's perfect. So one thing that I love to do on the podcast is really challenge what it means to be healthy and fit. Because I think so often when we think of what healthy and fit means, we see a certain body image or body size or certain behaviors even in our head. So I love starting out just by asking my guests, like, how, if at all, has your definition of what it means to be healthy and fit changed throughout the years?
Yeah. So, I mean, I grew up, in quotes, I air quotes if you're listening, in the American medical, community. And I trained in an endocrinology research center, an obesity research center. And obviously, the party line is, fat is bad, and, we should be counseling everyone on weight. And if someone goes to an optometrist or an ENT or whatever, their weight, and even if it has nothing to do with what they're there for, they got some wax in their ears or whatever, they get counseled on weight. And I think that's just the party line, and that's what we're kind of taught. So, and I just think back to being in a grand rounds, when I was a medical resident, and a cardiologist came and presented data on fitness, over fatness, and how fitness was so, so important. And it was like groundbreaking. Like, why? I don't know why that's groundbreaking, but it's just like, we have this idea that, if people are fat or a larger body, they can't be healthy. And it was like this paradox that, okay, they're fit, so they're actually healthy, but why do you have to like clarify that? So that's kind of like where it started. And then, I mentioned Alexis, and, we've been together a long time, and she's been doing this work, and she's been educating me on it. And I read a draft of her book, in conjunction with starting to like try and learn more about this on my own, and see patients. And it, full honesty, coming from where I came from in my training, it's pretty hard to like kind of like figure out how you like incorporate this model, because you're just, everything you're told is like, you got to tell people to lose weight, and you got to tell them like you can't have, this, and you got to cut your portions, and you got to, all this stuff, specifically around nutrition. And, it's hard to break that, that training. And, how do you talk to someone with diabetes or, PCOS about, eating, and we all just in diet culture and everything else with, what people are told from external forces of, this is good, this is bad, it's really hard. I mean, obviously people that aren't in the medical community still, like everyone's just bombarded by this, so but gratefully I started getting referrals, from non-diet, dietitians and therapists, and just really just listening to people's experiences and just following on social media, and it just kind of clicked. Too late probably, but it clicked, and I was just like, I got to do this. I'm learning. It's an evolution. Of just like, how do we, am I supposed to weigh patients because like that is important in certain situations, but like I also have to like look at what that can do, and like how do I like navigate that, and how do I like get consent, and how do I figure out how to do that well so that I'm not doing harm, but also, that clinical information is important in some situations. So we can't deny that.
Right. Yeah. I mean, just from my perspective, it sounds like I like the way you look at it in terms of balancing, like balancing like you said, the clinical things, the health things, but also with like seeing the patient, patient centered approach versus I feel like you mentioned, everything is so weight centric. And it's incredibly hard to unlearn all those things. But even just from me sharing some of the things that you have posted on Instagram, which like your Instagram has really blown up since I first reached out to you, I feel like.
Yeah, it's been like, I mean, you guys all like know what it's like. I didn't anticipate the like amount that of like what has to go into it, and I like actually like was like, I'm not posting anything today because I was just like, I need a mental break, and it's a lot, and I think if I didn't feel invested in this and like want to like learn how to like be a better doctor by doing this and like following everyone and like being engaged, I wouldn't do it. Like I would just be seeing my like 25 people a day in my office and trying to like be the best I could be for those patients. But I think there's like a bigger mission here for all of us.
Hmm. Oh yeah, totally. And I think too, like the more that we see the intersections between, weight and race and, all of that, it's like undeniable. But I can also see how it is at times it's overwhelming, but it's like, well, we got to do it. So yeah, I know that just from the people that I know who have seen the things that you've posted, even they're like, oh, I wish he was my MD. Like, I wish that I had somebody around here that I could meet with. So I think, yeah, what you're doing, it's making a difference. That's good.
Thank you. I mean, I've just been like floored by like and just touched, and just the direct messages from people around the world. Like, can I translate this into Italian or Spanish or like all this stuff? It's just and this is not like an American issue, a U.S. issue. This is global. There's weight stigma. That's there's no like language for that. It's just everywhere. So um, yeah, and you bring in the race stuff to it, and obviously I'm a white, like thin male, and I've learned to like, kind of like know that that privilege makes it different, and it's just important, and I think we're at obviously a crossroads, hopefully, with this like anti-racism stuff, and maybe I felt the same way, with this obviously is like, it's not enough to just like say that you aren't fat phobic, or that you're health at every size. If you're not like taking some action, like you're just as bad as everyone else.
Yeah, yeah, it's kind of like that silence is violence kind of thing. Well, let's talk endocrine system because I have so many, the whole hormone health thing is blowing up on social media. And even like myself as a health professional, even I'm like, oh my gosh, should I try an adrenal cocktail? Like, should I try all these crazy things?
There's other cocktails that are better than that.
I know. I was like, well, I enjoy cocktails. I guess I'll drink for my adrenals, I guess. But I want to first start out with, can you just give us like a rough overview of the endocrine system? I know that it's hormones. I know there's a lot of them. I know that they impact all the things, but give us an overview.
Yeah, so the way I kind of look at it, I mean, obviously we're alluding to the hormones affect everything, and that's what drew me to endocrinology to begin with, because I was like, okay, if I make the right diagnosis, or like we figure out what's going on, and we give the right like support for whatever hormone may be deficient, that's like game changing, right? So, but the endocrine system comes mostly from the pituitary gland and the hypothalamus, and there's stimulatory signals that come from those areas in the brain that stimulate the other kind of target hormone areas, other glands, whether it's the adrenal glands or the thyroid or the ovaries or the testes, all those things are just from that stimulation from the pituitary, and it all works on this feedback loop, right? So let's talk about the thyroid, right? So if the thyroid gland, which is in the neck, is not producing enough of this thyroid hormone, mostly something called T4, the brain senses that, and the TSH goes up higher to try and stimulate the gland and be like, hey, you got to put out more thyroid hormone here. And we could check all these things on blood tests, which is really cool. And based on that, make a decision of how to treat someone, and can make a difference.
So then what about all like the, I don't know if it's bogus or if it's real, like all the hormone health claims that are out there. Like, can you have a hormone imbalance? If you can, what might it look like? Adrenal cocktails, like, should we drink them? All the things. It's just, I don't know if you've noticed that, like how.
I mean, obviously, people come in and they're like, I think I have adrenal fatigue, you know, and I'm happy to entertain it and check an AM, baseline cortisol, and all the other tests that go along with thyroid and everything else that we do. But yeah, I mean, I think it's kind of like diet culture in some ways, because it's like there's money in it, right? Like, so, and that's the thing about the endocrine system, right? Because it's kind of like vague. Like if I ask someone like, how you feeling, like, oh, I'm tired, or like, whatever, like I'm depressed or whatever, and it's always like can go back to like the hormones, because thyroid and all these things affect the same thing, or low testosterone or whatever. So it's an easy target for supplement companies to be like, hey, here's a testosterone booster, or here's like some adrenal extract or whatever. But it's probably just like, you got to move around a little bit more, you're stressed out, you got to get some sleep, whatever. And a lot of times that's what it is, so I think most endocrinologists don't recommend those kind of supplements, and also it's not regulated, so you don't know what you're actually getting in those things.
I feel like what you said about it's like diet culture. I totally think it's this new spin-off of diet culture. But it's so hard because even I know someone who that's like her big thing is hormone health now. And it's like, man, will I really feel better if I do these things? But I just saw a post today. I'm trying to think of who it was from. She's a doctor and she said like, yeah, your hormones like really can't be that out of balance because of the fact that they function like through that feedback loop.
I mean, they can be out of balance, but like you have to have a medical problem for that to happen. Like you actually have to have like adrenal insufficiency. You have to like have a thyroid that's not working, like.
It's not just like, oh, you're stressed, your hormones are unbalanced.
I was thinking about this before. I mean, because stress has a huge impact on the body, and specifically the endocrine system, right? Because the adrenal glands put out the fight or flight hormones, norepinephrine, epinephrine, and high amounts of cortisol cause blood sugar to go up. High amounts of stress may affect thyroid levels. We're seeing that even with COVID, right? Because like fighting off things, like your demand for these hormones goes up, and so that can happen. And anything good that you do for your body tends to be good for your hormones. So same things that we would recommend for anyone, right? So like get enough sleep, stress management, like, move around, all those things. So it can happen, but taking a supplement, I don't think is the answer.
Mm. More so the healthy behaviors, like you mentioned, that we want to recommend everybody do those things. If you do those regularly, if those are in check, then you don't really have to worry so much about, like you said, like the supplementation and everything else.
Right. And if you legitimately have an endocrine issue, you should be seeing an endocrinologist, and you should be on a form of hormone treatment, endocrine treatment that is regulated, and you know what you're getting, and that's it, because it can be dangerous, you take, I mean, like, for example, like if people take thyroid supplement support from like wherever they're getting it, um, and there's a lot of iodine in it, let's say, or kelp or things like that, there's that can actually turn off the thyroid, because too much iodine loading, your body's like, I don't know what to do, so it's not without harm.
Yeah, that's interesting because I've always, even like when I see it, I'm like, oh, just more of I don't know, sometimes when they talk about it, it seems like a natural supplementation kind of thing. So I think knowing that, yeah, that there could be harm from it, because again, like you said, it's not regulated. It's important for people to know that too. So then when you talk to people, again, you've already mentioned these things like the, staying physically active and that's all of those things. How do you talk to your patients about that? Like what are some of the recommendations that you give to them? If they come to you and they're not currently doing those things.
I mean, I try and say, like, is there anything that you would like doing as far as moving your body? If like you hate running and I'm like, hey, like, have you ever thought about running a marathon? Like, what? Like,
No chance they're gonna do
yes,
that.
I'm gonna go out, I'm gonna start training tomorrow. No, not gonna happen, right? But I mean, it's a dialogue. What do you like doing? What can you envision yourself actually doing? Can you walk 5 blocks, every day and turn around? You know, is that possible? Do you like that? I mean, because throwing out recommendations like diet and exercise without a plan is just like useless, right? So I talk about, think I a lot of doctors and certainly therapists and stuff don't really like divulge a lot of personal stuff about themselves, but I feel like to me that like brings something to the table. So I would be like, I love yoga. Like, have you thought about doing yoga? Like, can you, watch a beginner's video on YouTube or whatever and have that conversation, and hopefully like the patients will be like, think about it, number one, and number two, be honest and be like, no, you're crazy, I'm not doing yoga, like whatever, like
Mhm.
that's not my thing. Okay, cool, try something else.
Right. I love that you say that because as part of my full-time job, at the University of Iowa, I do an annual lecture to the second year med student, or is it first year med students? I don't know, one of the two, about like using fitness as kind of like exercise as medicine, like using that recommendation and having those conversations. And this last year it was all virtual, and so students were like all in the chat box and everything, and it was so funny because some students literally asked, like, is it really going to make a difference? Because I use those examples. I'm like, stand up once every hour, or, use the stairs instead of the elevator kind of thing. And I had several students this time around that were like, but is that really just like encouraging complacency? Like, if they're not hitting the recommendations? I'm like, no, because they're doing something. And once they start with one thing, then it'll slowly increase. But if we start with like, go out and run, and they hate it, there's no chance that
Right,
they're going to be able to
right,
keep up with it.
right. And also potentially, if they're not able to do something that you're recommending, that's also harmful, right? So like
Hmm.
you tell someone like, hey, go start running, but they, aren't in shape enough to do that or whatever, that's detrimental also. And certainly if they start getting joint pain and things like that, they're not gonna be able to do other things like walking or yoga because they're in
Hmm.
pain.
Right.
So,
Yeah. And also I think it just like ruins trust and rapport that they have
yeah,
with you. I mean, they're just
absolutely.
like, what the hell are you telling me to go run for? Like, I don't remember the last time I walked around the block. So,
Right.
yeah. So talk more about, because I've seen that you've mentioned a lot on your Instagram about like meditation and mindfulness, and you mentioned just now yoga. I'm curious to hear more about that.
Yeah, so I mean, I think it works nicely and it fits into the endocrine system, right? So we were talking about stress before, stress management, impact on hormones, and I took a mindfulness-based stress reduction course, on my own, prompted by Alexis, because she's like, you're anxious, like, you think you got to do this, like whatever. And I was like, all right, like after 5 years, I finally was like, all right, fine, I'll just do it. So I did it, and honestly, it was like changed my life. I went, I did that raisin exercise and was like,
Yes.
this raisin is amazing. I was like, you know, whatever. And I'm like, I don't know if I've ever like looked at food and like tasted it and smelled, like we're all just like,
Mm-hmm.
"Whoa," like, and then like we had homework, right? So
Mm-hmm.
I had to like do this like 37-minute body scan and just lie on the floor and just like think about your left big toe and think about your like left ankle and like, you may feel something, you may not, and is it cold, is it touching, is your clothing touching like whatever. And I was just like did this, and it was like probably like 5 in the morning, 5:30 in the morning, and I just like was like, you think about the differences between left and right body, and like all of a sudden I was like, wow, the lights went on. Like it was just like, whoa, like like thinking about my body and like how I felt and like tension and all this stuff. It was like, so I started recommending to patients, and that turned into like a meditation practice and just trying to be like mindful and during the day, like not try not to like look at how many messages I have and like whatever, because it's on our medical record. I could see, oh, now it's up to 45 people I have to call back. Great, but just to like be there with the patient and whatever, and it makes a difference.
When did you do the MBSR class or the
When
course?
I did it in 2018, and it was probably like it corresponded to like one of the most stressful periods of my life. I was we had a fire right above us in our office, and I'm in a private practice. It's my own practice, and it's just me and 5 employees, and I have a physician's assistant. And it's like, we had this fire above us and water damage. Like we were all just here on a Friday, and we like had to evacuate. And I walked out of here and was like, when am I going to be back? And I like scrambled, and like Monday I had to like find a temporary office for a month and
Oh my God.
contractor and like insurance, all this stuff. And that was like probably like the same week I was starting this course.
Mm.
And like I was in this course, and it was just good timing because I think it just helped me, through that. And yeah, it was January 2018.
So I took a MBSR course. It would have been, I think, in 2019. I even remember, I think one of the biggest things for me was the like when they talk about like the responding versus reacting, like the pause, when a stimulus happens, like pausing, noticing what's arising in the body, and then responding to it skillfully versus just like getting pissed off, which is what I normally do.
Yeah. No, it's so you think about fight or flight, right? Cortisol secretion and all that stuff, probably dampens that response of like heart racing and all the other sweating and all the things that happens, when we're anxious. Just being able to do that and just, like this is what it is right now, like all that like stuff that you learn, right? And even I like the like idea of like, you're like outside the washing machine and you're just like watching the clothes like go around like vigorously, and you're just like this observer. You're just like, this is what's happening right now, you know.
I haven't heard that metaphor. That's a good one though.
Yeah, you're just watching like the chaos, but like you can just try and observe it, the same way that, it's kind of like the same thing with like foods or anything, right? It's you don't have to label like an emotion as like good or bad. It's just like what it is, just like what it is right now. And the second you do that, you decrease your reactivity to it, and it makes it okay.
I'm curious for like patients of yours who you've kind of prescribed or recommended meditation or mindfulness or yoga. Have they like told you about any changes that they've noticed in their lives?
I mean, a lot of times it has nothing to do with me. They just like happen to have been doing it, or they saw like a Headspace or Calm app or like whatever. But I feel like it makes the dialogue better in the patient doctor interaction, just because I feel like we're speaking the same language. Like similarly to like, talking about, intuitive eating or anything like that, I feel like it like amps my like energy up in my game, because I feel like, all right, we can like really like parse this out and like talk, and I'm not like talking a different language.
Yeah, it's like more conversational. You're on the same level. Yeah, that makes sense. But yeah, so I think like the more that we can introduce it to people in a more relatable way, and it's not like this foreign thing that you have to sit for an hour and think about nothing, it makes it feel a lot more doable for them. So I think it's cool that you bring it up to your patients or even just are willing to have those conversations with them.
Yeah, I mean, I think that it just goes with what I'm doing and what we're talking about,
Mm-hmm.
because people say like, well, what can I be doing for my thyroid? And I'm like, stress management, like whatever's good for your overall body is good for your hormones. And like
Mm.
part of that is like not being stressed and the mindfulness and being present, and like also, just enjoying things and like being in the moment. That's got to be good for you. Like,
Mm-hmm.
and the data on mindfulness and diabetes and chronic pain and all this anxiety, depression is
Mm.
pretty, positive. So
Mm-hmm. Yeah. Yeah. That's a good point. It's like if you can just practice something that's going to reduce your stress a little bit, like there you go, you're helping your hormones. You're doing a good
exactly.
job.
Yeah.
Yeah. So you've mentioned a couple chronic conditions like diabetes and PCOS, and you mentioned another one too. I'm curious to know more about, because especially like with type 2 diabetes, that is a very weight focused diagnosis or condition. But what role does weight play or does it not when it comes to managing chronic conditions like type 2 diabetes?
Yeah, I mean, right. So the paradigm is such that, if someone has diabetes, it's because they're fat, or, the way to treat diabetes is to get people to lose weight. Um, Fat and thin people have diabetes, type 2 and type 1. So, it's clearly not just about obesity or being fat. For me, the treatment has to be something that's sustainable and something that works. So I think if, we talk about cortisol and stress and all these things, recommending, restrictive diets and exercise that people aren't going to do and be able to sustain in the long term, I think is, going to be detrimental, psychologically and physically, right? Because, most people that go on diets will, inevitably gain the weight back, or and the cycling, I think the data, shows that that's stressful. And, I think focusing on the things that we're talking about, like getting enough sleep, joyful movement, the relationship with food, intuitive eating. I know these are all like buzzwords, but like they're buzzwords and they're cliched because, because they work. And, how many hundreds of diets are there out there that does the data just doesn't support, long-term effectiveness. So I think that's detrimental to people. And I think that's why this approach, I think people are really gravitating to, because when I talk to someone in my office who has diabetes, I mean, most of them, have been through all of that. And it's kind of like a new and refreshing thing to say, you know what, let's not talk about your weight. Let's talk about, having enough protein and fiber if you are going to have, something, with carbs, that just to balance out, the sugar content. Because if I tell you, hey, you can't have this, what's going to happen when you go to a party if I say, you can't have a cupcake?
Cool. You're going to
You
eat
go to
25 cupcakes.
25 cupcakes, but you're also going to go to a party and you're going to be surrounded by people having cupcakes, and you're just going to have this internal dialogue and you're just going to feel like shit about the situation. And that stress and that internal dialogue can't be good for you. So maybe, obviously the intuitive eating world would say, like, have the cupcake, enjoy it like you enjoy that raisin and Mbsr, and pair it with something that, with a fiber or protein or something like that's going to help, dampen the sugar response. And then when you're done, ask yourself, how do I feel? And if the sugar is really high, you're probably not going to feel that great, and you're going to be thirsty, and maybe the urination and all these things. And if you're in tune with that, then the next time the cupcake is there, and if you're really aware of what happens, you're going to be like, yeah, you know what? I can have that. It's not off limits, but I'm not going to feel good after. And you're going to have that kind of dialogue versus it's off limits and I can't have it. And now my heart's racing and everyone else is having the cupcakes, and wherever the mind goes. Um, so just being aware of those things. And I think let the body decide, and then have a rational conversation about it with yourself.
Yeah, that makes so much more sense too, compared to, even I think about, I had worked in like chronic care health coaching for a while and I hated it. I freaking hated it. I just like, my big thing was like, I'm not a dietitian, I'm not a doctor, but where I worked, they wanted me, stick with just the first thing to do is recommend 5 to 10% weight loss. If you can do that, and then X amount of carbs or reducing carbs. And even just the fact of, now I've switched my mindset to really being like, what could we add? Like you mentioned, the fiber and the protein, how could you add that in to support it? Or even like fruits and vegetables, like those sort of things. I just think back to even studying health promotion, and then in jobs that I've had and certification programs that I've done with, that I've gone through, that it's never the approach that they take. And I just think about like, man, I really could have impacted more people in a positive way had I known this, so much sooner.
That's the part that I struggle with, and I continue to struggle with, because how do you shift from like telling someone that they can't have something to that conversation of like, you can have it, but pair it with something else, or pair it with, like, how do you feel afterwards, and really like keying into the body. And then, or saying, have it, but like maybe take a walk after, or whatever, because if your sugar is high, you may not feel good. So take a 10-minute walk afterwards, and then, you enjoyed it and whatever, and hopefully you enjoyed it and you ate it, without feeling terrible about it and guilty. And then you take a walk, and hopefully, that walk makes you feel good. And then, you're winning all over.
Mm-hmm. Yeah. Yeah. I think it is so hard to change the perspective that people have about it. Again, going back to what we started talking about, everything is so like weight centric and everything. Um, Even, students who are still stuck in this mindset of, if I just eat less and exercise more, my body will change. And it's like, yeah, but you're also trying to study to become a mechanical engineer. Like, you really need, you need the carbohydrates, you need them for your brain and your body. And it's so hard to try to shift other people's conditioning. But I also have to remember, like, when I first started learning about it, like, it took a while for me to fully believe it. Even after seeing research, I was like, I just don't think that this actually works. But yeah, I think the shifting of mindsets is really, really hard.
It's really tough because, you're trained a certain way, but like, even if you believe and like, and you go with the whole premise that like weight loss is the answer, like, show me something that works long term and is not going to like make people miserable, you know, at what cost,
Yes.
you know, like,
Mhm.
I don't know. I
Mhm.
mean, and that's why I feel like recommending these things that aren't weight centric, like, hey, people may lose weight. Their weight may stay the same. They may gain weight, right?
Mhm.
Because if they have uncontrolled diabetes, people lose fat and muscle. The second you control the
Mm.
diabetes, they may hold on to muscle and fat. So they may actually gain weight.
Mm. So you had mentioned that there was a like one lecture or something in particular that somebody came in and was talking about like fitness over fatness. Was that when you were still like studying to become a doctor, or at what point in your career was that?
I'm pretty sure it's either residency, yeah, residency or fellowship. The
Okay.
cardiology like ran rounds, and I think, it was probably like a big name person, and this was like groundbreaking, right? So,
Mhm.
the cardiology and endocrine departments like went to this, and the guy was like putting up the slides, about how important fitness was, and like, I think like Reagan Chastain, like,
Mm.
I just did one of her workshops, and I think she talks about that, that even at like larger weights, like the fitness actually like is more important than, the weight itself. And
Mhm.
so yeah, that was kind of like, people were really surprised, I think.
So when you started your own private practice, were you like already kind of working from like the health at every size paradigm, or was it like a slow transition to kind of again undo the previous ways of thinking and everything?
Slow process, still going.
Mhm.
I'm like figuring it out,
Mhm.
just having these conversations like reinforces it. And like, and I think the dialogue is important. I get like pushback, and like people say, yeah, but like, type 2 diabetes, if they lose weight, like, won't they be better? I don't know, like, maybe, but is like, what's driving the weight loss? Is it like healthy behaviors? And maybe it's the behaviors that are actually like causing the blood sugar to go down. And like, if the weight stayed the same, they would still be better off.
Mhm.
So I'm just kind of learning, how to manage the patients from this model, because I think that this is the answer of how we're going to be better. And look, if you make someone feel terrible at the appointment, even if you have the intention of like trying to help them, if you give them recommendations that aren't sustainable, or you just look at them in that 15 minutes and you're just like, make a judgment about like what they're doing, the outcomes will be pretty bad, because they're never going to come back to see you, and then they're going to go to somebody else who's probably going to do the same thing, and then the same
Mm.
thing, and like, I mean, how many comments I get from people like in on these posts of like, I haven't been to my doctor in 2 years because, I got fat shamed, or like,
Mm.
I went in, or you hear stories like, like someone in college like went into like the medical center and like had abdominal pain, and the doctors like basically like told them to lose weight, and then went home and like passed out and had like a gallbladder attack and it became septic,
Wow.
so like,
Yeah. One thing that I've really learned is just that the weight bias is more harmful than anything. I mean, I think I've mentioned it on like 2 other episodes that I've done too, is it's like there's now research that shows that weight bias is more harmful to us or makes more of an impact on people's health than the food they eat and like how much they move and all of that. Like it's a huge thing. And I think, again, coming from somebody that like lives in a much more accepted body size, it's one thing to say that, but yeah, I think for folks that do live in larger bodies to, I don't know, to just like realize that finding a doctor that's going to treat them as a person and not their body size is really important.
yeah. And I think that, the studies don't control for that component of it, right? Because like all the studies, that's saying, being fat is bad and it leads to worse health outcomes and all this stuff. Like, unless they're like asking people, like, number one, like, are you going to the doctor regularly?
Mm-hmm.
Are you, stressed out because like you feel like you're being judged all the time and you're at work and like people are looking at like what you're eating, like that's huge. Like that
Mm-hmm.
must play a huge role in people's health overall, and just that stigma and living with that, you know and then the fact that doctors are like the number two offenders of weight stigma after like people's own family, like that's just we're not taking care of people if we're causing harm that way. Anything we do and say or prescribe or whatever, like if that's going on, like not only are you not enacting trust in the person, making them feel good about yourself, you're just going to keep prescribing stuff to like treat something and put a band-aid on it when we've got to really be dealing with the underlying issue of the stigma.
Yeah. I listened to an episode. I think it's like the "What Do I Eat" podcast. It
Yeah,
was Reagan Chastain was on it.
I just listened to that. Yeah,
Oh man, that was so good.
Dr. Josh was on the one after.
Yeah, I haven't listened to his yet, but
Yeah, they're both awesome.
so good. Like the point when Reagan said about like, yeah, we're not controlling for the fact that people that live in larger bodies, that their prognosis or like where they're at in regards to like their condition is probably further along than people
Yeah,
who, yeah,
yeah,
or something like that.
yeah. I think she was pretty much like with regard to cancer or something else, that because they're not going to the doctors regularly, they get diagnosed later with
Yeah.
with conditions like cancer because they're not picked up earlier, or
Mm,
the physical exam is not as comprehensive. They're not getting breast exams, or they can't fit in the MRI machine, so like you can't make a diagnosis until later, that
mm-hmm.
kind of stuff.
Yeah. And then it goes back to, you always hear people say like, well, if they can't fit an MRI machine, it's like they should lose weight. It's like, no, maybe we should change the system, the systems that it's
Right,
more,
right,
encompassing of all bodies. Yeah.
absolutely.
What else? Do you think that there's anything else you can think of that would be helpful for listeners to know in terms of like endocrinology, what you do, general health, anything that we haven't talked about that you think would be helpful?
Yeah, I mean, I think that the take home point for the endocrine system, just we're harping on it, but is just take care of your whole body, your whole system, and don't feel shame about your body, and if someone has diabetes or thyroid or PCOS, it's not your fault. Like a
Mm,
lot of this is genetics, and even if it wasn't, like have compassion for yourself, and find providers and find people that are going to support you and whatever's going on, and help you do the best you can and feel the best that you can,
mm.
and
Yeah,
and that's it,
that's good. Yeah, I like that you keep it so simple too. It's like do these behaviors, worry less about what you look like, keep taking care of yourself like you are. It makes it so simple. Like your patients are lucky to have you as a doctor.
Easier said than done, obviously. Like
Yeah.
I could say like all this stuff, but like unless someone believes it and like can own it, which obviously is a lifelong process, it doesn't happen overnight, and it's not even like something they're going to get from me. They're going to get from like work with therapists and
Mm,
nutritionists and hopefully like weight inclusive trainers and all this stuff. And I think that lends itself to like having a multidisciplinary like HAES approach, because 15 minutes with me or like any other doctor is just not enough time to do this work. You know?
Mm-hmm. Yeah, absolutely. Again, when I did that, when I do those presentations with the med students, I break it down. I'm like, if you have 5 minutes, you have the optimal amount of time, but realistically, you're probably going to have 1 minute to bring up fitness. Here's how you can do it. It's like, I think there's a lot of pressure even on, on doctors to have whatever conversations there are. And at the end of the day too, it's like, you only get so much time with them also.
Yeah. I mean, that's why like the like common like prescription is like diet and exercise. Hey, have you ever thought about like eating better or like exercise? No, I never thought of that. It's like, like,
oh, wow.
like
Yeah.
check, like
right.
right after like, you check the person's weight and said, oh, your BMI is like 28. Like, have you ever thought about losing like 10% of your body weight? Person goes out crying. You don't, I mean, that's the other thing that I was thinking about is like, we don't hear those things, we don't get that feedback. Like, we don't know what happens like when they leave here. Like, therapists do, the families do,
right?
Because like we may never see that person again, and if we do, like they're gonna come in and just kind of like be like bottled up and like, I mean, hopefully not, but like that's probably what happens, right? Like when they get the courage to come back to see the doctor, who's like every time they come in, they're like, oh, you really could lose 5 pounds. They're just not going to keep going. And if they do, it's just going to be like a bad experience,
Mm-hmm. Yeah, absolutely. Yeah. The mental side of it, the mental health side is equally as important. And I know that, that, and again, society's shifting to understand that too, I think.
Yeah, I hope so. I don't know. It's like it, but I'm like in the selection bias world of like, being in this community of Instagram, and I'm relatively new to it,
right?
But just kind of like following people that like talk this talk. But I'm not gonna lie, it's like stressful when I get comments and like whatever, and just trying to like figure out, how to answer those things.
Mm-hmm. Yeah. Do you feel like the comments that are questioning what you're doing, or more like
the comments of like questioning, like, well, like, BMI may not be perfect, but it is something, and it is the starting point, or like saying like, like the guidelines recommend weight loss, so like, you're not practicing evidence-based medicine. And I'm like, okay, if those are the guidelines, so be it, but like, does it work? Like, where are those guidelines being generated from? They're coming from the recommendations from the AMA that basically ignored its own scientific task force saying that obesity is not a disease. So like, can I trust the guidelines? And even if I believe that weight loss was the answer, I don't really have anything that is going to like work and make people feel good long term,
Right. It's not like there's an effective medication or something that's not going to harm them, other than, like you've mentioned, if you start exercising more, or you maybe start focusing on intuitive eating, maybe you'll see a change in your weight. But other than that, it's like,
you may not.
Yeah.
I mean, so like, if the objective is to like be healthy and like make people feel good,
doesn't really matter what their weight is.
That's what we should be trying to accomplish.
Yeah, absolutely. Very cool. Well, before I let you go, tell us where we can find you on Instagram if people have questions. I know that you probably have a lot of DMs and questions to go through, but yeah, if people want to learn more from you, where can they find you?
Yeah, so I'm everything_endocrine, and Twitter, which I don't really use as much, is just at Dodell MD, and that's it. I'm happy to chat and whatever.
Very cool. Awesome. Well, thank you so much for connecting with me. It has been awesome. I can't wait for more dancing reels.
No, I'm going to do one tomorrow, but I'm like embarrassed for myself. But I just feel like it's kind of like, I don't know, it's fun, and like, I don't know. We'll see how it goes. It may be.
Keep it up. We love to see it. Well, thank you so much. It's been great to connect with you.
Thanks for having me on.
Thanks again, everybody, for tuning in to another episode of GTB. If you aren't already, be sure to go follow Dr. Dodell on Instagram at everything_endocrine to stay up to date with all he's doing and to watch his reels. You gotta love him. If you're enjoying this podcast, feel free to rate, review, and subscribe. I will see you back here in 2 weeks for another episode, but in the meantime, go give him the bird.